Welcome to today's webinar, Inside a Wisconsin Health System's Push to End Scheduling Headaches. On behalf of Becker's Healthcare, thank you so much for joining us. Before we begin, I'm going to walk through a few quick housekeeping instructions. First, we will begin today's webinar with a panel discussion. We certainly welcome any comments or questions. You could submit those throughout the webinar by typing them into the Q&A box you see on your screen. Second, today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. Third, if at any time you have trouble with your audio or video, please try refreshing your browser. You can also submit any technical questions into the Q&A box at any time. We're always here to help. With that, I'm so pleased to welcome our outstanding group of leaders today. Laura Heeb, Chief Nursing Officer and Senior Vice President at Bellin Health, Brittany Shallow, Director of Nursing at Bellin Health, and Holly Holt, Vice President of Workforce Strategy and Optimization at AMN Healthcare. Laura, Brittany, and Holly, thank you so much for being here today. I will now turn the floor over to you to go ahead and get us started.
Great, thank you.
Thank you so much. Good morning and good afternoon, everyone. This is Holly Holt. I apologize, my camera isn't working this morning, and so I'll be joining via voice call, and excited to go over what's happening in the current landscape and go through our topics and agendas today to learn all about the amazing work that Bellin Health has done. So I'm going to kick us off by going over the current landscape and what we're hearing from CEOs, CFOs, and human resource leaders across the country. Overall, CEOs are saying that workforce is their #1 challenge, where CFOs are saying they need to be a little bit more proactive on how they're developing their workforce pipeline and looking to have more of an agile, tech-enabled workforce. When it comes to human resource leaders, their number one focus is really on strengthening the employee experience, where their second priority is developing leadership and workforce capabilities. So what we're overall hearing is just a focus on workforce optimization, efforts to retain and recruit staff, and using data and technology to better drive that experience. When we think about the evolution of where our workforce is going, this illustration on the page that you see before you highlights the mix and makeup of a workforce and how we believe it needs to evolve in the future. Having that foundational layer of core staff resources is paramount to ensure that patient continuity and great care that you provide. But moreover, we need to focus on more flexible layers of resources. That is the critical imperative here that we want to talk to you about today. And we want to work on getting to a small portion of contingent labor for that cost containment aspect. But we want to enable all of those workforce groups with automation, AI, and integrated technologies that can help save clinicians time, have transparency, share resources, and overall proactively align your workforce to where your greatest patient needs are. This is where we believe the evolution of healthcare is going. And if you are in a health system, in a hospital, we know that this is an area you spend a ton of time and energy on. And our objective today is to share some information about a tool and a path forward that can make it easier for you and to help automate certain aspects of your workforce. We've had the distinct privilege of partnering with Bellin Health on their optimization journey, and we're going to hear more about their story today. But first of all, we started with our consulting services to better understand their mix and makeup of resources. Just as the buckets you see before you, we looked and analyzed all of those different resource buckets. And then we implemented SmartSquare, which is our scheduling enterprise technology tool that helped with automating and managing their resources. Of our 20 years of experience with SmartSquare, we found that it takes a symphony of strategies to execute a successful workforce plan. And those plans need to be rooted in the data and technology, but that plan also needs to have some standardization on policies and procedures and change management aspects and a really purposeful and mindful plan to execute it. And I'm so excited for you all to hear more about how that works within Bellin, and I'll turn it over to Laura to kick us off.
Great. Well, thank you, Holly, and welcome, everyone. I just want to start by just sharing a little bit about who we are. Bellin is part of a larger system called Amplify Health. Bellin actually went through a merger in December of 2022 with the Gunderson Health System. And now together, we have over 11 hospitals and 100 clinics in a couple different states, Wisconsin, Minnesota, Iowa, and the Upper Peninsula of Michigan. And Brittany and I are excited to share a little bit about the work that we've done here in the Bellin region, which is located in Green Bay, Wisconsin, And yes, that is the home of the Green Bay Packers. And Bellin Health is the official healthcare partner of the Green Bay Packers. In our health system, we have about 5,600 employees. We're licensed for about 244 beds in our acute care facility, as well as we have a psychiatric hospital, a critical access hospital, a surgery center, and then multiple clinics. We currently have about 1,200 nurses that we work with in our facility, and I've been in the CNO role for actually 18 years. So when it comes to managing the workforce and seeing the changes over the years, we definitely have seen that. And as Holly mentioned, post-pandemic, we really have learned some things. And one of those things that we learned is the need to really have tools in place that help us manage our workforce, understand how we're doing related to efficiency, optimization, and then how we can have tools that help our clinicians who are expressing the desire to have more flexibility in their scheduling and in their ability to know what their work schedule will look like. We went on a journey and we said, you know, what other tools are out there? We had a tool, I would say it was kind of the basic tool. You put the schedule in, you spit the schedule out. But what we realized is we still had many areas of the organization that weren't on this tool and that still had tucked away a lot of paper, Excel sheets. Everybody had their way of keeping track of their workforce. And what we wanted to do is say, you know, can we put a tool in place that gives us the greatest visibility across the entire system so that when we want to look at our workforce and we need to shuffle people around or look where there's gaps, we would have better visibility to that. So we went on a search and ultimately we decided that we needed to partner with someone like Smart Square and implement their product into our system in the spring of 22. So as we did this, there were a couple key things that were really important. One, we had to define why. What's the vision of this particular project? And what do we hope to accomplish? And one of the things that we learned, especially through COVID and the challenges with workforce, is we really wanted to get a tool that helps us get the right resource in the right place at the right time and ultimately for the right cost. So that was really important. Then we had to look at, okay, what are the key resources we're going to need if we're going to go through this evolution, put a new product in place. So it was really important for us to get our key resources and teams aligned. And then most importantly, we needed change management, because pulling people out of the paper world into a world that is more automated comes with a lot of change. And that was going to be really important for us in order to be successful. And then ultimately it was implementing our product and then achieving key outcomes. So I want to start a little bit with the vision. And, you know, we talk about the why, and the obvious one is it makes it really easy to see how are you managing your workforce, and are you utilizing people to the fullest capacity? Are you putting people in the right place at the right time? But the other thing that actually comes with a more advanced tool is the ability to empower and engage your clinicians. And this tool gave us the ability to allow our clinicians to pick up schedules and do a lot of that work that before had to flow through multiple people in order to get accomplished. So making our clinician lives easier was one of our key outcomes that we are looking for as we embarked on this process. We also wanted something that was flexible and adaptable. One of the things that we learned coming post-pandemic is with the workforce changes, we started introducing a lot of new roles into the system, and we had to have a tool that was going to help us include those rules or those roles into our scheduling product. So we needed a tool that had some flexibility that way also. But our main goals is to get off of paper. We needed to standardize processes. We had many departments kind of doing their own thing as far as who gets called in when, and we wanted to create a lens that was a system think lens versus a very department specific lens. So that was part of our goal coming out of here. The other thing is we had a greater vision for the future, and that is we wanted a resource management center that all of this work could be housed in. And we started with inpatient nursing, but we also then spread to our psychiatric hospital, our critical access hospital, and ultimately the goal is to roll it out throughout the system. So at any given time, we could see what the workforce looks like anywhere throughout the system through our resource management center. And then as an adjunct or an outcome of a lot of this work, we also wanted to control our labor spend. And so you're going to hear a little bit about how we did that. And it kind of seemed, when I first heard this, a little bit counterintuitive. We're going to give incentives that seem pretty large, and that's going to save us money. So we had to wrap our heads around how we could use the tool to help us fill holes, fill them early, and impact our schedule. Then we had to look at our key people that were going to be involved in this project. And myself as the CNO and SVP, my job was to put forward the request through our senior team and talk about what the need was and what we could accomplish. So in our system, we have a high performance healthcare population health model. And in that model, we identify what are the key projects for the year, and then we operate in a regular cadence. So I brought forward this project. We had to identify what's called a functional leader. Who is going to be that operational leader, boots on the ground, is going to help make it happen. And you're going to hear from Brittany, who is our current functional leader. But when we started this project, I had another individual in that role. And my learning was that I had to be sure that I allowed the person enough time to focus in on this work because of the significant change that it would present to the organization. So in the last year, Brittany picked up this role, and you're going to hear some amazing results with her as our operational leader. And then it's really important that you have an administrator of the tool. There's a lot of technology in here, and you need someone who is expert in that technology. And so we have a person dedicated to really managing the tool, the changes, the updates, troubleshooting, and really being connected with our Smart Square partners. And then we had to create our team. And our ongoing project team had project management as well as an improvement advisor. One thing I would recommend that we didn't have is I would put an actual change management leader on the team and identify them specifically. Then we had our executive team. So as we went through this work, we felt it was really important to have partners in HR, finance, and education, so that they really understood the work that we're doing and the impact that it would have. Hindsight, if I were to do it again, the other team the other group that I would add to the executive committee is really your ITDS, or your IT and decision support people, because reporting and connecting your financial reports with this work is very important. So next, one of the biggest things was the actual plan. How did we go about executing and delivering on this work? And the first thing that happened, and Holly mentioned this, is we had to have an operational assessment. And in our organization, again, I brought forward and said, here's our project that we would like to work on. Here's the outcomes we'd like to achieve. And we kick it off into our strategic priority process here in the organization. And from that, we then operate in 120-day cycles. And when we started the project, it started as a strategic priority until we got to the execution phase. And then once we got to the execution phase, it became an operational priority. And in that, every 120 days, we had very specific tactics that we were working on and goals that we had to achieve. And what's really great about our process that we use here in our system is that these 120-day priorities and strategic priorities are communicated across the entire system. So everybody knows, hey, we're working on this, and here's the resources needed, here's the goals that we are trying to achieve, and the expectation is that we all support each other in accomplishing these goals every 120 days. Then we come back as a leadership team at the end of the cycle. How did we do? What is the work that needs to accomplish, or did we accomplish everything and we can move on to something else? So it is a great cadence that keeps us in alignment also with what Smart Square had as an execution plan for rolling out this project. The other thing that was really important is that change management approach. And I'm going to have Brittany talk about her role in helping us as an organization move through this process. Brittany?
Perfect. Thank you, Laura. So as you mentioned before, I took over as operational leader about a little over a year ago for our Smart Square project. So change management, so keeping in mind our mission and vision and what we wanted to accomplish for our goals. Change management was that key component and needed to be the primary focus. So the first step that I did a lot of discovery. What are those pebbles in the shoes of the operational teams? What are those barriers? How can we work through those and get those accomplished? So really re-engaging those frontline teams and understanding the why behind those barriers and struggles was the first step in listening and hearing their whys. Secondly, it was level setting and ensuring that we had expectations for our end users and then engaging them into the process. So once they have some skin in the game and they're right there with you making some of those improvements in processes, the outcome was in our journey was very successful in that regard. So yeah, the biggest thing was having those frontline key members embedded into that process to speak about our success for our goals. As you can see it's on my right of the screen, the standardization decisions that we needed to make in order to be successful across systems. So each of our units, probably the same in your organization, they all have their little nuances, little cultures. They do things just a little bit differently. They're their own kind of organism living within that entire system. So how do you get the entire system talking to each other? And then having the decision rights of standardizing your scheduling, your staffing, and then your policies. So it took us a long time. It was about 6 months going through all of those decisions and standardizations, and then bringing them to our operational team leader meetings to having them have that voice and consensus on what we wanted to do moving forward as a unit and a team systematically. So it was standardizing our policies in order to have that one source of truth to avoid any unnecessary conflicts. So that was one of the biggest barriers that we had was, well, we do it this way, they do it this way, and really coming to that standardized one source of truth. So when making those operational decisions related to staffing too. So when we're not here, we're a hospital 24/7, making sure that we have those decision rights in our frontline users who are managing the throughput and staffing 24/7. So on top of standardizing our policies, we also introduced different types of team-based care models to our organization. So during the pandemic, we wanted to ensure we were using the right role for the right licensure, so at the top of their licensure. So we did introduce LPNs back into our care models. And then we are also currently venturing down virtual nursing too. We have that embedded in 2 of our floors as well. So ensuring that we have the visibility of where that is within our organization was key in working with Smart Square for that customizable approach to taking care of our patients here in Green Bay. So we added the LPNs, but we also ventured with our schools, and they started a youth apprenticeship program with our local high schools, and then really supporting them too as CNAs and growing our current healthcare workforce too. So we did a lot of flexible things, 4-hour shifts, 3-hour shifts, in order to get these high schoolers exposed to our healthcare at an earlier age. And then it was a recruitment technique as well, as when we got them in, they were interested, and then on to nursing school. So we have some success stories of individuals who are completing nursing school now, who started as youth apprenticeships. So we helped them in their goal, in their journey along the way. So at first, with all of this change, and of course, there's a bunch of data and you get data overloaded, and ensuring, am I looking at the right data? Is it validated? Is it accurate? And is it correct? I will tell you, we were skeptical at first, but we had a fantastic data analysis. His name was Steve Riley, helped us ensure that the data that was being presented on our dashboards and on our KPIs was validated, and it was accurate for us to ensure that we were making our decisions moving forward with our improvement processes based on those data points that Smart Square was able to provide to us. Within Smart Square 2, there is also a predictor model too for census, and we were able to validate that is 95% accurate when you're looking at throughput and then capacity within your organization. So I will go next slide. So I can kick it off to Holly.
Thank you, Brittany. Thank you so much for the overview and all those elements that Brittany and Laura just walked through on their initiatives to change their approach. Those are really the decisions and enablement that they needed to automate the technology. And I'm going to kind of walk through these 4 buckets of how the work gets done. But before I do that in detail, I want to illustrate to you all on the line the thoughtful and intentional implementation that goes into automating their policies and processes, the business rules that they decided how they want those workflows to go within Smart Square was well thought out and tested and trained their full staff so that how Smart Square is deploying and working for them is all based on their decisions that they made at the upfront part of the implementation. And so I'm going to walk through these 4 buckets and then talk a little bit more about OpenShift, because our Bellin partners here are going to walk through the outcomes they've seen with using these tools and embedding all those amazing operational assessments and strategic plans they just talked about. So when it comes to Smart Square, we decided to build the technology from an enterprise mindset that is going to do everything it possibly can to proactively align your resources as far out in advance. So the first bucket of resources that get scheduled 90 days out are your core staff resources. We have a specific algorithm that sets them up to align their schedules based on the predicted patient demand. And you heard Brittany say 95% of the time they're predicting within the resource of what that forecasted need is. After the core staff schedules get done and submitted, then OpenShift starts 30 days out from the start of the shift. And OpenShift is really an automatic way to post those open shifts that weren't fulfilled in core staff scheduling as it aligns to your patient demand. And again, 75% let me say it differently. When OpenShift starts producing shifts, we're able to fill almost up to 75% of those hours that are needed. So as you can see, about 60 to 70% of hours are scheduled within the core staff, then more 15 to 20% of those hours are filled within OpenShift. So we're trying to fill more shifts as it comes along to the day of the shift. And that OpenShift, as the needs get filled, you can add incentives to that if you'd like, or a variable model or a set amount, but the system automates it based on whatever the organization wants to do. When it comes to the start of the shift, 48 to 24 hours before the start of the shift, the system will automatically
align your resources based on your live census feeds. So we get multiple live feeds into SmartSquare throughout the day that shows heads and beds at a certain time of day, and you can add in any acuity adjustments that you would like. And then you start looking at your contingency layering and last minute needs. So up to that point, when the shift starts, people are going to call in sick. You're going to have people maybe pick up an extra shift here and there, but you're using that timeline in SmartSquare to deploy your resources that have the right competencies to go to the right units to where the greatest patient need is. So the whole system works in a way that does not require any manual intervention from your clinical leaders. And once that shift gets worked, always we recommend and have that 24-hour after it goes into the management reporting after that shift starts. You want to look at your financial and productivity outcomes. You want to look at, did everybody work up to their FTE? Were people clocking in earlier, clocking out late? What were some of the opportunities that we could learn for the next time as we develop our schedules and post-open shifts? Is there anything we'd like to tweak with the system? Was there any workflow that maybe didn't work? What are your users saying? What are your unit councils? What is their feedback around how it's working so that we can continue to improve and make it work for everyone? So I want to dig in a little bit more into the open shift aspect and what happens within that 30 days out from the start of the shift. So the way that SmartSquare is designed and the open shift module is that it's powered through predictive analytics. It's a patented open shift management process, and it gives organizations like Bellin the ability to cost effectively fill their gaps in the schedule based on the forecasted need. It is flexible enough to also service complex union environments. We have many organizations that do that on the union with their CBAs. The predictive model incorporates modern modeling technologies and machine learning methodologies that will forecast the staffing need. We update these weekly, and as those predictions pass through the staffing plans and matrices for each unit and service area, they're clearly identifying the predicted demand versus the scheduled staff. We also have some additional features within SmartSquare that can help do recruitment and push out recruitment campaigns through a rapid shift recruit that will identify qualified staff and alert them and when open shifts can be picked up, and they can do that via their mobile device via text message. So in all, the platform is designed to be proactive. It's designed to save clinicians time, take away some of the administrative burden. And then as those business roles get defined by organizations through implementation and they continue to monitor and look at how those workflows are happening, there are some great outcomes that have been achieved. And I'm going to turn it back over to Brittany to talk about their outcomes.
Yeah, and before Brittany talks, though, the one thing I just wanted to point out, and it's interesting, like any project you implement, it's critical that you say, okay, well, how did we do? Did the project achieve what we needed it to achieve? And, it was a journey for us. There was a lot of change. And I was a little skeptical. I'm like, we invested in this. Are we really seeing the results? And what Brittany is going to share is just some tremendous outcomes that we've so far been able to achieve. And the belief is that there is more out there that we will be able to achieve. So Brittany, I'd love for you to share the great results that you helped facilitate.
Absolutely. So the most important part is establishing that workforce team, optimization team, and then the committees that go along with it. So we meet twice a month with our SmartSquare AMN team. So they have an operational team that meets with us. We really go through what are our barriers. Are there any IT issues that we're having with SmartSquare? And then it takes that time for what are we working on as a system, as our strategic objectives that we want to accomplish this 120. So we keep our 120 at front twice a month at both of those meetings to make sure that they're keeping us on track on what we want to achieve, and there are partners in that space. Just like what Laura alluded to prior, is the organization knows what our objectives are and what we want to accomplish in those 120 days. So really, with that, we met our goal of transitioning off of paper scheduling, and then technology enterprise-wide. So improving our access, our staffing transparency, and then ability to float resources based on patient demand. We had some of these, I always say, we had some of them in the system already, but just being able to transparently execute it and to have that commonality with all of the floors helped improve that access or those bottlenecks. So if you have staff, if you have patients coming in, how can we allocate resources in order to decrease that bottleneck? So if it's in our emergency department or if it's on one of our surgical units and floors. We did go live with implementation of our incentives in March of 23. So you can kind of see there when we did go live with it, how many more open shifts that we were able to proactively pick up for that. We also embedded the Smart Square education right into our health streams, right with our organization. So it's on our platform instead of trying to get the education and aligning it with Smart Square and having our system admin, Heather, do all those educations. So it's a self-pace that individuals can take. So that was a win for the system when people were doing taking over the schedules or becoming new charge nurses, you know, granting new access. They were able to do that at their own pace. Like I said before, the standardization of our staffing policies, our practices across our organization for our acute areas, and then also our standardized staffing policies across our med surg. So we had more transparency with those med surg floors that we currently have at our hospital. We are utilizing the business intelligence tools. So we go over those, we use those at our at some of our committee meetings, and our TLs are to use those when asking for additional FTE or if they've had an increase in census. It's a tool that helps have the case for our fill rates. And then our big one that we are continuing to measuring down is the Resource Management Center Foundation build. So this is kind of phase one. We hired an industrial engineer who has a master's degree in project managing to help us with capacity, throughput, and patient flow. So we hired someone without a clinical background to help us clinicians in some of the areas that we know we need a little bit more of a robust team. So identifying what types of tools that each individual has, and then being able to execute on them. So Jacob has been a fantastic addition to our team. He already has a bunch of data points and graphs and all of this that I probably couldn't do, probably would take me a week to figure out. So so he's been such an asset to our team in the last 6 months here. And then utilizing the predictive analytics for more accurate scheduling. So being able to know it's our busy time of the year, we're going to need more resources allocated during this time than it would be during a February or March time, depending on our volumes here. The big wow that we had for an incentive cost. So really we wanted to make sure that the work that we were doing, the improvements that we were doing, how can we quantify that to a number, or that we had some type of savings on this. So working with our financial analysts within Bellin, we were able to analyze about 1,300 hours within our within Smart Square based on our legacy pay. So our legacy pay was critical needs, so time and a half, offering that out. As Laura said before, we're offering out this incentive for this, but it actually overall contributed to a 28% cost reduction, and we were able to find a net savings of $1 million in savings over an entire year of open shift pickups. And then you can see below the open shift pickups by source and day ahead. So it's the amount of core contingency. So contingency means premium hours, so above what their normal FTE or the number amount of hours that they worked. And you can see the proactive approach of 30 days prior to, and it does then decrescendo down to the day one before. So staff want to know if they want to pick up, they want those hours. They're more proactive of picking them up than waiting for last minute. Laura, anything else to add on this slide?
No, I think the thing that was really important, and I mentioned at the beginning, making sure that you have ITDS or your decision support people involved in the process is, as we went to the incentive program, we realized in our analytics behind the scenes that we couldn't see how much we were spending right out of the gate in the same venue as our other financials. So we had to do some work tying those things together. And that's where I was like, well, are we spending more money, less money? Has this created a positive outcome for us? And I see we're missing a zero on that slide, but it was over $1 million in actual savings of what we had spent today with the new tool than what we would have spent in the past. And coming off of COVID, we were in a serious, we had probably 70 plus travelers that we were using in the nursing areas, and we're down to about 15. We were able to hire people in. We were able to get people to work and pick up shifts who are currently employed individuals and incentivize them to create an overall positive outcome for the system. So we were just really happy with this. And the other thing is, the staff are happier with the ability to pick up shifts when they want them and how they want them. So if all of us know we have people in our organization who want to pick up and earn the extra money, and when they do that early, it helps us not have those last minute issues that come up. So it's been very positive in that sense. So what's next? Brittany mentioned we actually hired an engineer into our resource management center, and we again have a plan to roll out scheduling for all areas of the organization. And I think I saw someone ask if we have it in the procedural areas, and not yet, that they have actually come to us and asked for it. So we are in the process of saying and evaluating what's next on the agenda as far as rollout when it comes to using this tool. And then ultimately the goal is really to have that resource center have the oversight across the entire region and working collaboratively with our staffing office in the management and movement of people. The other thing that we want to do is, again, leverage the tool to work on those emergent needs. So all of us know that sometimes it just so happens that the bus pulls up in front of your emergency room and empties out a bunch of patients, and you got a lot of patients that need care. And so we still have, I think, opportunity in that space to say, how do we have enough flexibility to handle some of those big surges that hit us as a system? And we want the tool to help us with that. The other thing, as Brittany mentioned, is we have intelligence tools, and we want to be sure we're using our data when we're making decisions. So when we go to FTE committee and we're asking for more staff or trying to make our case, the leaders have to be able to articulate how they're using their teams, to what level, and we have to be sure that this schedule matches up with our productivity targets that we have in the system, and that the leaders are performing to that, and that if they're having challenges, that we're solving those things together as a team. And then ultimately, we have a big epic, as we merge this in 22, we're going to be coming together with our epic systems with Gunderson and Bellin. And when we do that next July, we're going to have the ability to implement Epic, the Nurse Wizard integration into Smart Square, which will be another opportunity for us to just integrate all of the data so it flows seamlessly from one system to the other. So as we think about our journey that we have been on, and like any good journey, right, there's curves in the road, and there's bumps, and there's things, potholes that you might hit. We had a lot of learning. And there's some key things that I think are super important. And one is that you set a really good vision. What are you trying to accomplish? And is it that you're just trying to, again, save financial resources, Or what are some of those other balancing measures that are you're able to talk about as you paint the vision for your team? It's really important to have a dedicated group of individuals implementing this and working through the change management that is needed. Also, one of our significant learnings early on is that post-pandemic, our core staff on some of our units had been depleted as people had left the organization to go travel and do some of those things. So when we implemented our incentives early on, we faced a little bit of a struggle because we did not necessarily have enough people to fill the core needs. And the incentives were designed that the earlier you pick up, the more money you get. The closer you get to the day of need, the less the money. Well, when you didn't even have core staff to handle your day-to-day operations, that was a motivator for our teams. So we had to work really hard on building the core teams back up. So as you go on this journey, you want to really understand where your core staff is for every department and what level of flexible staff that you need. And then, I think it's important, as goes without saying, engage your front line. There were a few times where I had to sit down with teams and really talk about what were they seeing, how were they feeling, how were they experiencing this, and really work to be sure they were engaged in the process and had voice into this overall process. And then probably most importantly, what I found is picking the right partner. In our case, as we've collaborated with Smart Square, and they'll tell you, Holly and the team will tell you, there are times where we had some really heated conversations as we were trying to work through some of this and get things executed. But all along, having a good partner who is going to be there to not just sell you a tool, but to really sell you a solution that is going to partner with you and work with you through the process so that you truly optimize it and that you can deliver for your organization in multiple facets. So I really am and give them big credit for going on the journey with us and helping us through that process. And with that, I think, Claire, we can kick it back to you if there's any questions.
Awesome. Yeah, thank you all for such an excellent discussion. Well, now we'll go ahead and begin today's question and answer session. Again, you can submit any questions you have by typing them into the Q&A chat box on your webinar console. So I'm going to go ahead and get us started here with our first audience question. So one of our audience members would like to know, have you been able to utilize this platform in a clinical setting?
We do have it in our urgent cares and our fast cares. Currently, we don't have it in a traditional clinic setting, but definitely we started with the individuals who were seeking additional help and support from our staffing office, and we started who really touched base with our staffing office, and we started with those units and those roles. And then we definitely are looking to expand just what Laura said. They've been reaching out to us, our case management team, our facilities team, and then our surgical and procedural areas as well, that they would like to get up on Smart Square with us. But we did implement it in our home health department as well.
Yeah, and I think the clinic setting is really interesting because, again, we learned if you want to cross-utilize teams and staff, it's really great to have that full visibility. So if we have a better understanding of what's happening in our 30 clinics out there, and are there staff where maybe they're not having a productive day and they're cross-trained to work in another area, we'd have that ability to move them around. And so the tool will give us that visibility. And so we're in a slow cadence of rolling it out throughout these various areas.
Great, thank you. Our next audience question Our next audience member would like to know, does this system allow multi-location staff scheduling, assuming that policy allows it?
So you can schedule in multiple locations if the user, he or she has it in their profile in order to pick up shifts. So it is based on what units the individual can have. So our float team, I'm just going to say an example, our float team, they have all of the units, so they can pick up on any one of the floors depending on where the greatest demand is, where they're seeing, and they're scheduling that way as well. So it's really very individualized per what the skill set is for that individual. So if they're a mom baby, but they came from psych, because you get that sometimes, and they still want to pick up in psych and do hours in mom baby as well, they have that flexibility and ability to do that. I hope that answers your question.
Great, yes. Someone else would like to know, what advice does the Bellin Health team have to provide to other hospitals that are looking to optimize their workforce?
My first piece of advice is first seek to understand your workforce gaps and needs. And that is really important, that you have a full understanding of where do you have opportunity, where do you have gaps in your core staff, and how much do you have in your flexible pool. And I'll give you an example. One of the things that we use is we say we want to have a core staff in a department that covers 85% of the need. And then we'll use the other 15% from flexible staff. And that's either people picking up or our float team. So we have to understand that. And some departments that are full all the time, they can run at a 90% core staff. So understanding that was really important. And then I think the other big thing is know that when you start messing with people's schedules, that there's change management in it. And so again, probably the key thing is engage your teams early and have a clear vision of what you're trying to accomplish. Because if your vision that you're holding is, I want to get rid of paper, I want this visibility, but if the leaders aren't on the same page, you will still have paper things squirreled away and people will still be using these back processes, and you won't have gained the efficiency and the things that you need. But setting that clear vision, outcomes, measurement, and execution are all key elements that are important to this process. And then don't underestimate too the need to have a couple core dedicated people who are really working this. And I give Brittany a ton of credit. When she took this over, she went in and spent a lot of time sitting in that office and understanding how does the tool work and how can we optimize it to, again, deliver a better experience for our teams. And you need someone who is going to understand it in and out, and the interplay that has with your workforce policies that you have. Brittany, I don't know if you have other words of advice.
No, that is, hearing, listening, understanding their workflow, and then embedding how do you operationalize it. That's the key part of it. How do you build it into their day? Because they're going to continue to do what they always have done because we've always done it this way. But then saying, hey, we could do it how about like this? Or how about like this? So I know the staffing office, I went through and I'm like, lay out your entire day and then say, yep, we could eliminate this. This is how you would do this. And it was working with them in order to show that we can improve efficiency. We don't have to write this or do that. So it was really sitting down with that team and just understanding what their workflows were, and then having them as part of that solution was really impactful.
So our next audience member would like to know, what algorithms or data points does SmartSquare used for predicting patient influx?
So right
Yeah,
now,
this is Holly.
go ahead,
Oh,
Holly.
you go ahead.
You can answer it. I know it too, but you can go ahead.
Okay, well, you let me know if I missed anything here, Brittany. The data points that SmartScore uses for the predictive model, it combines a couple different things. It first looks at your staffing plan and matrix that's aligned to each of your departments. And so we're looking for how many skills you need at each certain time of the day. We usually break it into 4 or 5 different increments throughout the day. And then it will pull in your census feed of, what are your patient volumes at each point of that throughout the day. And we look at as much history as we can. Typically, we request at least up to 3 years, but it looks at all those historical trends by unit, by shift, and then we marry those forecasted, those historical census points up with the staffing plan, and that will populate the forecasted demand. It also takes into account seasonality, where you're located at in the across the country, and things that take into account within your region or area. We're also looking at the next model and forecasting ability to look at forecasted absences, call-ins, leave of absences, anything that might impact your planning of getting the right resources at the right mix. The predictive model, it can push out and start up to 100 days out, and it gets more accurate as it gets to the start of the shift. And what we've seen is that 95 to 97% accuracy, at least 30 days out from the start of the shift. Brittany, anything you'd add?
No, and we went through and validated all of that. So yes, it is, for us, it was 95% accurate 30 days out from when we were predicting and inputting out our needs, and then anticipating what our census would be from that 30-day mark.
Mm-hmm.
It's amazing on how you could look the next day, and within one nurse, that's what you're recruiting for, with that flexibility. So,
and that's, what's really important about that is that trust and credibility of the tool is really important for the frontline leaders. They have to trust that the data is accurate. And we all know that many times it's data denial, and we have to go through that emotional cycle. But once you can start validating and showing them the predictive ability of the tool, it actually starts to, I think, resonate with the teams, and they become more reliant on it.
How does SmartScore handle... Sorry.
I'm sorry, I was just going to add in one last component here, as it relates to the predictive model and the trustworthiness that Laura and Brittany are commenting about here. Is it is embedded in multiple areas throughout SmartSquare. It is not just one page. It's how your schedule gets developed, how open shifts get posted. And so the biggest change that organizations I've seen make is being able to trust and schedule to that predictive volume versus scheduling to max capacity. Having your staff aligned to that prediction is a game changer for how you're able to meet more patient need and not impact your staff satisfaction overall.
Mm-hmm. Yeah.
How does SmartSquare handle last-minute changes or emergencies in staffing?
Great question. That, in the world of acute care staffing, that happens all the time. And so the way that SmartSquare is designed up until the start of the shift is the ability to take the census coming in, and for units having the ability to make adjustments if they have a sitter or one-to-one. Things could change really fast, where you might have a 2-to-1 ratio, but now you have 4 patients that all need one-to-ones, and now you need 3 more nurses. And so those things change really quickly, and SmartSquare can help you plan for that with those open shifts that get posted. But within a 24-hour window, there are a few things that you can do within SmartSquare to provide more resources, using the recruitment platform, the text messaging for people to pick up shifts up until the start of the shift. And really it's you need to have some resources and processes around your house supervisors, your central staffing resources, to really look at the holistic picture and figure out how you can move your resources around to balance out the needs. So instead of having one unit run 3 short, maybe you're having 2 units run 1 short, and how do those charge nurses and the house supervisor and patient transports feel about that, and being able to spread that shortage across multiple areas versus just one area. So the ability to look at all of your units at an enterprise view is how Smart Square can help with that, but there is the clinical decision making that needs to come in to figure out what's the right care plan for your patients. Brittany and Laura, anything you would add?
No, I know that we're working on emergent needs too with Smart Square. They'll be implementing that because there's going to be, with flu season coming and people have nuances and seasonal things that sometimes you can't predict everything. We can predict pretty much probably 95% of the time, but there's going to be 5% of the time where you have a bunch of sick calls, or you have a unit that gets influenza and you need to recruit for those types of needs. It's happened. I've had it happen. So really looking to Smart Square too, and engaging with them in their emergent needs and pushing that out with their incentives as well.
Yeah. And I do want to comment on one part about that, because there are things that come up, and sometimes that's where we gave good feedback to Smart Square, because these scenarios happen. And the one thing I always talk to the team about is that we still, as clinical leaders, have to manage and care for our patients and keep a safe environment. And so at first it was easy sometimes for individuals to use the tool as a barrier. Well, I'm not able to do that in Smart Square, or I can't figure it out, therefore we can't do. And so again, that's why it's so important to get that feedback and say, what problem did we experience, and is there a way to solve it, and how do we not have the tool necessarily be a barrier to solve an immediate need that we have if there's patient safety on the line. So some learning that has to go in that space, because you never want to tie the hands of the team, but you also want to have a very clear philosophy of what you're trying to accomplish.
Well, unfortunately, that's all the time that we have for today, but I would like to thank Laura, Brittany, and Holly for such an excellent discussion, and AMN Healthcare for sponsoring today's webinar. To learn more about the content presented today, please fill out the resources section on your webinar console and fill out the post-webinar survey. Thank you for joining us today, and we hope you all have a wonderful afternoon. Thanks so much.
Thank you.